welcome to R.K Medicos. In this section, we are going to discuss about the galactose metabolism and associated malformation or the associated disease with galactose metabolism. If there is any deficiency in the enzyme of the galactose metabolism, what are the disease is associated? That is basically galactosemia is the disease which is developed due to the enzymatic deficiency in the galactose metabolism. So let's see what is the galactose metabolism first, and after that which enzyme is deficient is leads to the development of galactosemia disease. So first we can see here in the galactose metabolism there is a metabolism of galactose is happen, and the galactose metabolism is basically the breakdown of the galactose, how the galactose is going to break down in our body. So you can see this galactose is going to convert it into galactose 1-phosphate. The galactose is converting into galactose 1-phosphate in the presence of an enzyme that is galactokinase. That is same as in the glycolysis there is a glucokinase in the glucose converted into glucose 1-phosphate. Same there is a glucose converted glucose 6-phosphate by the hexokinase. Here also hexokinase is used, but not now. Now here we can use galactokinase, which is converting the galactose into the first place the phosphate group is attached, that is galactokinase. Next we can see this galactose 1-phosphate is converted into the glucose 1-phosphate. This galactose 1-phosphate is converted into the glucose 1-phosphate in the presence of UDP glucose is converted into UDP galactose here, and one enzyme is present here. The name of this enzyme we can see galactose 1-phosphate uridyl transferase. Galactose 1-phosphate uridyl transferase. This enzyme is going to transfer the phosphate group in the several way, and the short form of this enzyme is called as GALT, that is GALT, galactose 1-phosphate, that is uridyl transferase is the short form of the GALT, this enzyme. And after that we can see this UDP glucose is forming the help in the formation of glucose 1-phosphate from the galactose 1-phosphate and converted into UDP galactose in the presence of one enzyme, that is epimerase here. This epimerase enzyme is leads to the conversion of again from the UDP galactose to UDP glucose. We can see in this picture this UDP galactose is converted into glucose, and after the UDP galactose is also converted into several way, that is the lactose and complex carbohydrates is also formation from the UDP galactose and this epimerase enzyme. And here we use basically three enzymes till now. The first I am going to mark here by the yellow color, that is the galactokinase, the first one. The second one is GALT, that is second one, and the third one is epimerase. These three all enzymes is going to deficient. It leads to the three different types of galactosemia disease develop, and all three type of galactosemia is divided into basically two classical and non-classical types of galactosemia. What is classical, what is non-classical type of galactosemia, we will see after several minutes. But for now we have to understand what is galactosemia is it. The amount of glucose is increased in our blood, that is emia means blood and galacto means galactose. The amount of galactose is going to increase in our blood, that is the galactosemia disease. So what is the classical galactosemia? When the enzyme deficiency, that is GALT enzyme is going to deficient, GALT, that is second one. We can see this GALT is going to deficient second enzyme, that is the galactose 1-phosphate uridyl transferase enzyme is deficient. It leads to the development of galactosemia classical type. What is classical galactosemia? Basically the absence of enzyme GALT. It means the conversion of galactose 1-phosphate into glucose 1-phosphate will be inhibited. It means the amount of galactose 1-phosphate will be increased, and this galactose 1-phosphate amount is higher in our blood. It means the galactose basically increase in our blood, and it leads to the development of galactosemia, that is classical type. Next we can see what happened into the galactosemia non-classical. There is an enzyme which gets deficient, that is galactokinase. In this case there is only galactose will be increased in the blood, not galactose 1-phosphate. Galactose 1-phosphate is more toxic than the galactose. It means the galactose 1-phosphate is more toxic. It means they are going to produce more severe galactosemia, and that is Galactosemia classical type is the more toxic. Production of the galactose 1-phosphate leads to the classical galactosemia, and that is more toxic than the galactosemia non-classical. Now we are going to see what is the classical galactosemia here and what enzyme is going to defect here. In this, I already told you the galactose 1-phosphate uridyl transfer enzyme is going to deficient, that is GALT. So there will be galactose 1-phosphate amount will be increased. According to the metabolism, this enzyme is going to increase, this compound is going to increase. What is it? Galactose 1-phosphate, because this enzyme is deficient here. And we can see when this enzyme is going to increase in the body, that is galactose 1-phosphate is going to inhibit something. This enzyme is, or this compound is going to inhibit the glycogen phosphorylase enzyme. And this glycogen phosphorylase enzyme is essential for the breakdown of glycogen. What the glycogen is stored in our liver, is stored in our muscles. This glycogen is going to break down by the process of glycogenolysis. So we have a special type of enzyme for the breaking down of this glycogen, that is glycogen phosphorylase. But due to the galactose metabolism is inhibited in the absence of enzyme GALT, this enzyme is going to inhibit this glycogen phosphorylase enzyme. So due to inhibition of this glycogen phosphorylase enzyme, the amount of glycogenolysis will be also decreased. And glycogenolysis when happen in the first part of biochemistry, in the general biochemistry already discussed, glycogenolysis is happen in the early fasting stage. In the early fasting stage, basically 4 to 16 hours of hour after the eating. So 4 to 16 hours between them, this glycogen is going to break down, and it's not happening actually because it is inhibited by the galactose metabolism. So their inhibition is leads to the decrease in what? Glycogenolysis metabolism. It decrease in glycogenolysis metabolism, and it leads to, if there is a no glycogenolysis means no glycogen breaking down leads to the glucose. No glucose means hypoglucose, means hypoglycemia. Glycemia means basically glucose. Glycemia means glucosemia means in blood, and hypo means lower. The lower amount of glucose in the blood. It is listed when in the fasting or early fasting stage. In the fasting stage, the low amount of glucose happen in the classical type of galactosemia. What are the symptoms we see in these patients? In the patients having classical galactosemia is developed. So first, it's happen in the first 2 week of the life of a baby. When any child is going to develop, in the first and second week of the lifespan of the child is developed, onset acquired, this disease is happening. And the breastfeeding is initiated these symptoms. The breastfeeding is basically lactose. Inside the lactose there is a galactose is present, and this galactose inside the lactose, the breast milk, the lactose is higher in amount, and this lactose contains galactose. So the galactose is higher in amount in the baby or the mother breast milk. So these milks are going to feeding in the initial stage of the lifespan of the baby, and these diseases are developing at that time. That's why they are the acute onset of the first and second week of the life. So the failure to thrive is developed in the baby. There is a vomiting and the feeding difficulties. Feeding difficulties is happening. Now the patient is also suffer from the seizure and coma due to the hypoglycemic condition, or the hypoglycemic coma is developed in the patient due to lower amount of glucose. Lower amount of glucose is formed because of the lower cycle is formed in the fasting stage, which glycogenolysis is less cycle due to the galactose metabolism is going to inhibit the enzyme glycogen phosphorylase. So seizure, coma is happening, hypoglycemic coma, intellectual disabilities, all the mental retardation is appeared in the child. There is a mental intellectual disability or the mental retardation is appeared in the child. Also there is a hepatomegaly. Hepatomegaly is occurred due to what happened? This galactose 1 phosphate is more toxic, and this more toxic substance is going to accumulate in the liver of that baby. And inside the liver, this galactose 1 phosphate substance's toxicity leads to the liver size is increased, and after that leads to the liver failure, and this liver failure is also leads to the development of a jaundice in the baby. So it's all happen one by one in the step manner. Next we can see the child is also having developed wild drop cataract. The child is having also developed a special type of cataract, that is wild developed cataract. We can see here wild drop cataract. There is a galactose 1 phosphate is going to accumulate. This galactose 1 phosphate is going to accumulate because the enzyme is deficient cult. It means galactose 1 phosphate is going to accumulate from the metabolism, and this is going to reduces the galactose into galacticol and deutetol. Galacticol and deutetol are the reduced form of the galactose, and these are the two form is appear in the wild drop appearance in the form of cataract in our eyes. So now you can see a special type of disease is also developed due to the galactosemia in the child, that is E. coli bacterial disease is developed, that is neonatal sepsis. Neonatal sepsis is developed in the child due to the bacterial infection, that is most commonly E. coli in the galactosemia. Now we are going to see how we can diagnose the patient suffer from the galactosemia or the child suffer from the galactosemia. We can see that a Venedict test is positive. Venedict test is basically done for the reducing sugars, and you know the galactose is a reducing sugar. The galactose is the reducing sugar, that's why the Benedict test is positive. Benedict test is always done for the reducing sugar only. Next point we can see the glucose oxidase test is negative. Glucose oxidase test is specific for the glucose only. So this test is of course here negative because the galactose is not a glucose, it is a galactose. Galactose is reducing sugar. So the glucose, for the glucose what test we done? That is glucose oxidase test. For the galactose Benedict test. So now we can say the mucic acid test, that is the mucic acid test, in which the patient, if the patient is suffer from the galactosemia, the child is also appear at special type of test is positive, that is mucic acid test. Now next one is galactose tolerance test is contraindicated here. Galactose tolerance test is contraindicated, of course contraindicated, because galactose metabolism is inhibited here, and enzyme studies is most specific type of diagnosis is it. If the patient is having enzyme study, we can do the enzyme study when the any baby suffer from the enzymatic defect. So it's must to know about the which enzyme is going to defect in the which metabolism. So it's giving us a specific result about this diseases. So enzyme study in all the in all the metabolism disorders, enzyme study is must. Next one we can say genetic mutation. We also have to study about the genetic mutation if there is any type of a specific mutation is occur. Next we can see what are the treatments. What are the treatment of galactosemia we can provide the child. The lactose free diet is given. Don't give the lactose to this child. Lactose free diet will be given. Next, the breastfeeding is absolutely contraindicated because the breast milk is having lactose, and lactose contains a lot of galactose. So the galactose, once again it's producing galactosemia, and these severe symptoms will be appear in the child, what we see in the above. So the symptoms are very severe, so we are not going to give the lactose to the child. Next one we can see by the 4 or 5 year of the age of this child is developing a special type of enzyme in his body at the time by the age of 4 or 5 years, that is galactose 1 phosphate phosphorylase or pyrophosphorylase. We can say galactose 1 phosphate pyrophosphorylase, it gets activated. These enzymes are only activated by the age of 4 to 5 years, and these enzymes, what they are doing, these enzymes are converting the galactose 1 phosphate, what is the toxic substance is accumulated in our body, it leads to the more toxic and galactosemia is produced. It's converting this enzyme, is converting the galactose 1 phosphate is more toxic into the galactose that is less toxic or not toxic. So these enzymes are activated only by the age of 4 and 5 years, so they are not more specific for us, but at the age of 4 and 5 years these enzymes are activated in our body. Now we are going to see what is the non-classical type of galactosemia. In the non-classical type of galactosemia we can see it is a benign condition. It is not fatal or the net malignant condition. It is a benign condition. It is the not that much severe condition for us. So benign condition, not so much toxic. Now you can see what is the enzyme deficient is regulated in the galactosemia non-classical type. In previous one we can already discuss the galactosemia classical type, there is only one enzyme is deficient, that is GALT. But in this case there is two enzymes are deficient, that is UDP galactose epimerase. Basically epimerase enzyme, already see the epimerase is converting galactose into the glucose. UDP glucose into UDP galactose into UDP glucose. We can see next one galactokinase, which converting the galactose into the galactose 1-phosphate. So these two enzymes are the non-classical type of galactosemia, and there is only one manifestation of this non-classical galactosemia, that is the cataract. Cataract is the only, we can say, only one manifestation in the galactokinase deficiency. Galactokinase deficiency is first one, where the conversion of galactose into galactose 1-phosphate. There is a galactose enzyme is deficient, and it is a non-classical type of galactosemia. And there is only one manifestation, the child is appear is having eye cataract. So these are the all about the galactosemia disease. What are the different types of galactosemia, non-classical and classical type of galactosemia, and what is the metabolism of galactose, how the metabolism of galactose is occur in our body, and what are the disease associated with the galactose. So this is all about the galactose metabolism. In next part we discuss about the different metabolism disorder. Thank you. See you in next video.